I think you're staying up late at night doing your Guru
Yeah,
Nation.
yeah, man. Guru After Dark, Rad Raphael,
I was there
ladies
one
and
night.
gentlemen. The After Dark has taken on a life of its own. I mean, people keep wanting it back, but this is yet another segment. Thank you so much, Rod. He's
Sure.
an ally of Save Our Sites, Sites Rock Behind Us. Fresh off of meeting you a few months ago, you were on one of the panels. Rod's a site owner in Indianapolis. I have his LinkedIn underneath this video. Rod approached me with a unique angle, and life happens to all of us. Like we always say, we're all patients, and in this case, it became very real for you, and you're nice enough and transparent enough, and I think caring enough for patients to let us look into your journey as a site owner, but also as a patient yourself right now. So if you want to just share a little bit of what's going on.
Yeah, it's unusual to be the patient, but it's eye-opening too. So when they died last summer, I was having issues, obviously, with my bladder. So, and I thought there was blood in it, and we checked and there was, and my doctor was like, yeah, you probably need to go to the urologist. So I went to the urologist. Um, she knew what I did for a living. So she was a little more candid about some of this than I think. Maybe that's just the way she is in general. But to me, it seemed like she was more candid about it. So she did a cystogram, say tube that they put through their urethra. They look at the bladder, and when she got it, she had asked me, "Do you smoke?" Now, so before we go on, that is the number one cause for bladder cancer. And I'm going to assume, though I haven't really looked, vaping and chew and all that still have the same carcinomas in them, probably even worse than vaping, that cigarettes did. But I haven't smoked for years. But anyway, when she went in there, she goes, yeah, that's what I suspected because you smoked, right? She goes, I see. And she called it a tumor right from the start. So she wasn't pulling
Hmm.
any punches with it. So she sent
What
me
were
to
some of your symptoms, if you don't mind sharing? Like,
urgency, frequency. I mean, peeing every time I turn around.
and like
Um,
even if you cut caffeine, because usually when I get that, it's usually due to caffeine, and then when I cut it, it's able to
I
control.
wouldn't say that it's necessarily the I can't say it's caffeine,
Hmm.
and I'm not willing to stop it. I mean,
Yeah, yeah.
I did cut way back this last
Mm.
month when I was not feeling great. Anyway, when she did that, she sent me to a urologist, another urologist, an oncology urologist, and he said, "Well, let me go in, let me look at the cyst, or the I'm going to do a TERP, and I'm going to go in and look, and we'll take care of it right then." Anyway, they staged it. It's like this area is new for me. I'm not fully
Right.
knowledgeable around this area, but it was like a uh, in one a in zoo in no, it's pretty STIU. I forget how you
C2,
pronounce.
C2,
Yes.
NC2. Mm.
So I thought, okay, well, that's I expected it to be not too far along. I didn't really think it would be because I hadn't had the symptoms long. I just felt like it was going to be a pretty easy fix. Well, it is an easy fix, I guess, in a sense, except that I didn't realize bladder cancer tends to come back.
Mhm.
So even if they take the tumors out, you have to continue getting scoped and looked at because you don't want it to invade the muscle wall, which it hasn't done any of that. So I've been on the study for since beginning of October, I guess, late September, October. I was doing, I mean, amazing. I wasn't having any symptoms. I'm getting an immunosuppressive by IV. And then the interesting part of it is a device that they're putting in through the urethra. It's called a pretzel. It's about the size of a quarter. Obviously, it goes in straight, but then when it's in the bladder, it folds up like a pretzel, and it dispenses the chemo for 3 weeks at a time, and then they take it out and replace it. So,
Hmm.
I've been doing that. I was doing great. And then I just didn't feel well. I mean, my whole bladder was inflamed and the whole thing. Luckily, I got to the point in the study where they give you a 3-month retrieval from that pretzel. So yeah, I went ahead and did it, stopped it, and now my symptoms are back to almost normal. Though I do have some slight um, fatigue, and tiredness from and he said that's probably from the immunosuppressive therapy. That's messed with my labs a little bit. Like I had to go to a cardiologist because it raised my troponin level or whatever it was. So they
Right.
had to make sure I wasn't having a heart attack. And no, it's just the response to the immunotherapy. And this last week and a half, I've had, the um, fatigue and swollen glands and a little bit of a fever for a day and a half. And, so I could live with that. It was the other part that was horrible. And I'm going to back up for a second because when I went to the oncologist, it's a large group here in Indiana that does urology. They offered me a study, and I was like, oh, well, that's great. It's a Janssen study for people that have failed. I think it's BCG. BCG is the gold standard at the moment, which is from tetanus, and it's been used for bladder cancer. I think it was one of the very first drugs used for chemo, is what I read. So I was kind of happy not to go on that one because there's a lot of side effects with it. I was, it's a coin toss, and I was randomized where I would have either gotten the BCG, I would have gotten what they call TAR 200, which is the device, I believe, that I just told you about, and an IV. There's an IV drug. So I could have gotten one or both of those or the BCG. Luckily, I got the flip of the coin gave me both of the immunosuppressive and the chemo. But it's not as simple as I thought it was to repair or to fix. It's not. It's a long-term, it's a 4 or 5 year study because of the fact that bladder cancer can come back at any time. So it's something I'm going to get checked. I'm going to be checked now for probably the rest of my life to make sure it doesn't invade the muscle wall or
Right.
beyond. Because when it does that, then your odds go down. There's still a 77% chance survival rate at 5 years in all of it. With mine, it's a 97%, I think, chance.
Yeah.
But at 63, yes, I'm gonna have to deal with it for the rest of my life, but something's gonna take me anyway. Probably won't even be that, but it hasn't been, I had 6 weeks of just horrible. I couldn't work. I didn't want to do anything. But now I'm back to work. This is my 3rd day back in a row, so I'm feeling better.
Wow. I'm glad to hear that. And
I was fine at SOS, and then a few weeks later, I wasn't. It was just like a light switch.
were
So
you already in the study at SOS?
I was already in the study, yeah. I
I
just
see.
wasn't really telling everybody about it.
Right. Right.
Um, but I was pleased that they offered me the study, and I was pleased to try, or thrilled to try something other than the BCG because there's a lot of side effects with it, even though it's still considered the gold standard.
What are
This
your, being a site owner for all 2 decades plus, or maybe 3 decades plus now, right?
18 years, I think.
18 years. What, like, first of all, have you ever been in a trial before?
I have not been in a study before. It was pretty eye-opening when I went the first day, actually, that I went in, and you probably appreciate this. They had a new coordinator along with the other older one. In my head, I thought she's not going to last. She won't be here very long. And she
Right.
was. My doctor's
What
like,
made
well,
you think that? What made you know that?
just because of her, not her attitude, I could tell she wasn't comfortable doing research.
Hmm.
Um, she wasn't comfortable either at the site. They were doing, she was in a cardiology indication before that, so she wasn't used to office specific research studies or whatever. It just, you know how you sometimes you can tell when someone if someone's going to last or not when you hire them,
Yeah. You
and
have like
that's
a spidey sense that tingles as a site owner. We just interviewed someone earlier today. Um, and I had some senses about this person, and once you've been doing this long enough, you kind of know. I think you could be
yeah.
wrong too. At times you could be wrong, but looks
Yes.
like you were right in your
My doctor's
situation.
like, I wish you had told me this 3 weeks ago.
But okay,
When
so
she
what
when she
like
decided to leave.
take us through the journey. So
So
you just
far,
went for like standard of care, and then they offered you a trial, and you
they did.
said, did you like look into it, or did you just say, you know what, let's just roll with it, or were there different options, or was it just one option?
Oh, I'm sure he had other options. Well, he did the BCG,
Mm,
but um, I did look at the consent. I took it with me. I was pretty sure I was going to do it, but I
mm.
still, wanted to investigate a little bit. There's some other studies for bladder cancer. Bladder cancer supposedly is the number one highest um, cost in cancer because it comes back. They can't get rid of it
Did
necessarily.
not know that.
I didn't know that either. I didn't know that smoking was the number one cause of it either. So don't smoke.
What are some of the other causes?
Well, if you have blood in your urine, oh, you mean what else causes it
Yeah.
to get, um, when you're exposed to chemicals or, what am I trying to say? Man-made things, or no.
Synthetic, yeah.
Yeah. So,
Plastics, maybe plastics in the water supply now.
right.
There's a lot of things going on. Pesticides, perhaps.
Pesticides, yeah.
Bladder cancer is not something that's discussed that often.
It's not. There doesn't seem to, you don't see a lot about it, but yet it's very common in men and women.
Hmm.
Women have a hard time getting diagnosed because of the UTIs. Uh,
Right.
but I mean, if they have blood in their urine and they rule out a UTI, the first thing they should do is a cystogram, and because
Hmm.
it's just indicated at that point if you can't figure out why they're bleeding, uh,
Yeah.
or
And
why something.
the thing with bladder cancer in males is men do get UTIs. It's not as common as females, but they can get UTIs.
Yeah,
And
I've had one during the study, but I really wasn't. We know as coordinators or medical assistants or nurses or whatever in the field what the symptoms are supposed to be, but yet I don't think I even realized. I knew I had something going on, but
mm,
I wasn't sure that it was a UTI.
oh, you had one because you're taking immunosuppressants, right?
Right. So they put me
That's
on
one
an
of the side
antibiotic.
effects. Yeah.
Um, yeah, UTIs can make you Looney Tunes too if you're an older adult.
Yeah. Yeah. It's not a comfortable
No, and people get really they get crazy on them if they don't know they have one.
yeah. That's what I'm saying. A lot of people think, maybe it's bladder cancer if it's male. And then for
Yeah,
women, bladder cancer usually goes, like you said, undiagnosed because they're quick to jump at UTI, even though, I mean, you may have a UTI and not show positive for nitrites or any of that kind
right,
of stuff. So
exactly.
they'll still say, it's a atopic UTI. They don't have any other term for it.
You can
Um,
be proactive. I mean, if
mhm.
it was me that kept pushing because I had urine in my blood, and um, so he said, yeah, you probably should go. He had me recheck it, and then I missed the recheck, and then I did it again, and he was like, yeah, I guess we should probably send you to the urologist to see if something else is going on. So
Wow. Did you have any like burning sensations when you urinated or any of
no,
that kind of stuff?
I mean, on and off since. and blood. You know, they just went in and he took the tumor out initially.
Yeah.
There was two of them actually. They actually both, I don't remember what the second one is, but it was actually diagnosed as a different form of it.
Mm.
So I had one form, and then this one's, it's weird how there could be two different kinds of cancer in the bladder, but I guess there can be.
And then you, in your case, you were a smoker in the past, like in the past.
Like 30 years, yeah. Years
Oh,
ago.
you smoked for 30 years ago. You smoked.
Not 30 years ago, but I smoked probably for 30 years.
Oh, for
And I
30.
stopped
Okay,
probably 15 years ago.
I see. So it's yeah, the cigarette, the smoking is so bad for you guys out there. As far as the patient journey though, so far, like, did you ever feel like you wanted to withdraw? Did they do anything
Uh,
to keep you motivated? Do you wait long for your visits? Like all the things that you can now bring back to your
right,
site.
as a coordinator.
Yeah.
I think all of that sometimes, a little bit. At some point I was like, when I met that first coordinator, I was like, she doesn't seem like she knows what she's doing. I'm
Yeah.
not sure about this now. And then I had somebody blow a vein on my arm with,
Mm.
all it was a vacutainer and a vacutainer with one venipuncture too. I mean, all it was one tube. They were
One
drawn.
tube and they blew your vein?
Oh man, it blew up bad. I was like, guys, we need to pay attention to what we're doing because this is really sore. You forget,
Wow.
you forget as a coordinator what it's like to be poked and prodded
Yeah.
and be
Yeah.
the patient. A lot of us don't know what it's like to be a patient.
We're all patients.
I've never really been a patient like this. Um,
Mm.
but for the most part, it's been a good journey. I can tell that they are overworked, running their full
Yeah.
heads up. Um, but I still feel like I get the attention from the physician. Uh,
Okay.
so that's good. I do get one-on-one conversations with them. Not at every visit, but most visits I can, I talk to them. So that's good in that sense. Um, Communicating, when you're trying to get a hold of them and give them your symptoms and stuff. At first, I thought they weren't really paying attention to my AEs, my adverse events, like when I thought I had a UTI or um, just some of the symptoms. But they were. I mean, I just didn't seem like they were, but they were. She had it in her head. She just wasn't writing it down yet.
Do you
Uh,
have any like diaries you take home or e-pros or any of that like tech
oh,
stuff?
I have a stupid e-pro that I have to do it in the office. That
Oh, in
asks
the office.
the ones that the diary are laptops that ask you how you're. I don't do them anymore, so I can't think of the proper term for them. They ask you your quality of life. Were you able to dress yourself this week? And
I
all that
see.
stuff. So yeah, I've had that. They haven't figured out the Clint Pro, the card
Mm.
system yet, because I haven't been paid yet. And I've been on it since Sep- early, late September, early October.
Or are you supposed to get paid for
I
participation?
do get paid. It's not a lot. I think I want to say it's like 70 something dollars. And your
That's unusual
caregiver,
for a cancer study. Usually
and
those ones
yeah,
don't.
I mean, typically
Yeah,
you're right. And then the caregiver will get a similar stipend if they go with you. Like my wife went with me the first couple times, but after that it was,
I
you know.
see.
So a typical visit though is I go in and they put an IV in, or they may draw blood first, do the vitals and stuff, and this immunotherapy they give me. I had what I thought was a slight reaction to it at first. So they gave me
Yeah.
Tylenol, Benadryl. And if you've never had IV Benadryl, wow, it'll knock you on your butt.
Wow. Like
It's not
immediate?
like taking regular.
Is it like
Oh,
fast, like right away?
oh yeah. I mean, you feel it like,
Wow.
not a bad feeling actually, but
What
so
do they
anyway,
give the Benadryl for? Is it like a before
because I was
the
having flushing and
okay.
my temp went up a little bit, came right back down, the flushing went away, but
I
we
see.
continue that regimen now. when I do the IV, and the IV takes about an hour. And then I
Okay.
usually stay, and then he does the insertion of the device, the pretzel, in
So
the
do you
office
go like for a weekly cycle? Like a
every
week,
3 weeks.
every 3 weeks? Okay, so just once every 3 weeks.
So I get the IV and then
Okay.
the device, which right now I'm on a holiday from it for 3 months, thank God, because I
Okay.
was so sick last month. Um,
Hmm.
but as a
There's
patient,
one of the things I read from Tim Ferriss when he wrote 4 Hour Body, and this was like in '09, but they've actually done research on fasting. They found that patients that undergo chemo, maybe you want to try like this mini experiment on yourself, but patients that undergo chemo, if they are fasting for 48 hours prior to the administration, they have much less AEs than
mhm,
those that don't. So if
that's
you can do
interesting.
like a pure water fast for, if you can't do 2 days, try
Yeah, that's
24
way too
hours.
much.
There's like some interesting studies they've done on this, specifically with chemotherapy.
Huh.
And yeah, I've had a few people I've known that have gone through chemo, and I let them know about this too in case they're feeling up for it. Like,
Sure.
yeah, so maybe something to keep in mind if you feel like doing it next time, unless the AEs are tolerable. Uh, but maybe you get more used to it the more you do it, like the more cycles and the more times you go in.
I don't know if you get used to it or if you just, or if it must be building up in my system because I didn't have any symptoms like for the first almost 12 weeks,
Wow. Okay.
maybe even
Oh,
more.
okay. Okay.
Other than that flushing I had the first day with the
Yeah.
IV, we could have stopped that and not done it at the next visit, but I was like, let's not. Let's just do it what we've done and make sure that I'm not going to have a reaction to it.
Yeah.
Um,
Do you, and you just like, how long have you been in this study so far?
since the beginning of late September, early October. So
Okay.
up
So
until
6 months.
February, I was perfect. I mean, I felt fine. And then I started getting a lot of irritation and frequency and just general, the whole bladder area is the way it was described to me was that the whole thing was inflamed. When he went in and just did this turp last week, which for those that you don't know, it's like having a surgery. They put you out, they go in through the urethra, obviously. They look through a camera to see what they can find. If they find more tumors, they're going to remove them. He said it was so inflamed, he did scraping, in the same area that he found the other tumors. Um,
Mhm.
because yeah, I was bleeding a lot. Like
You
before
were
the
going through it.
two
Yeah.
or 3 days before, I was bleeding quite a bit. Now I'm not bleeding hardly at all. So I know
You were
it's so
going through it
graphic for
to
people, but
no, it's important for people to understand. I mean, and thank you for sharing your story in regards to this and allowing us, Guru Nation, to follow along because it's, you're a site owner, and I mean, you've done this research like most of your life now as a
now
business,
I'm on the
and
other side of it. Yeah.
now you're on the other side. Well, now you're on both sides because you still
Both
have
sides. Yes.
your day job.
I
So,
still have my day job. Yeah.
yeah.
Um,
Does it
yeah.
give you more empathy for patients, or has that not really
Yeah,
changed much?
it does, especially with blood
Uh,
draws and IV
for blood draws.
and stuff, because I found that I guess it's the immunosuppressive is making me bruise a lot more. So I think that's why she blew the vein so bad. Because when I was on vacation, I did have some acupuncture
Oh,
because
you did? Okay.
I was having low back pain on my right side and my hip. And I bruised. I mean, you should have seen the bruises on me all over, because all over my back and stuff. It was just unusual because I've never bruised like that. So you
And those are the things that you don't really um think
As,
about, you know.
yeah. We
Yeah,
hear
you
this
get
stuff all the time from patients, but then it's
our
different when it's
patients
yourself
complain. We
or
have one
family.
study where there's what, how many tubes? 17 tubes for a screening visit.
Yeah, mine's
You know,
like
and
that.
we hear the complaints all the time, but once you're doing like a couple of those every day, I mean, everyone's going to complain, and you just say, okay, there's not much we can do. It's part of the study.
We put
So,
patients through a lot. I mean, now that I'm on
yeah.
the other side doing this, the
Mhm.
diary and the IV and the insertion of the catheter. I mean, obviously I'm on a more intensive type study, but
Sure.
we asked them to, like they asked me that I have to go get blood work before I do my therapy. So like 4 days before I go get blood work, and it's a lot of time commitment, and then I'm off that day that they do that. And, um, you miss time at work, and just trying to be both is not fun sometimes, both
No,
the coordinator and the patient. But it does make me think about our patients more now. Not that I always had empathy for them and stuff, but it's just different when you're the patient.
yeah, it's definitely a lot different. It's a good reminder. I think we're gonna, if you're, as long as you're up for it, do regular updates with you. Um, Maybe any new insights you get as far as the trials from the patient journey. We don't get enough patients sharing their experiences, so,
No, we don't.
and it's
Not the
not
patient
that
here
often that
earlier that I'm
I mean,
sorry.
we're all patients, you know, and
Yeah,
not all patients are site owners though. That's the unique thing about your situation.
right. So, but I thought it would make for a good video, and I think if we take the journey, it would be interesting for you to post, for me to post on
Yeah,
our
yeah.
pages, your page, my page. I
Hmm.
thought it would be beneficial to people to see as coordinators, site owners, and as patients.
Yeah. And thank God they caught it early. Thank God you were hyper vigilant about it.
Yeah.
Maybe
And
that's
I
because
think
of
you
your
have to
clinical
be,
background.
if you know something's going on with your body. I think if you're being misdiagnosed, or you think you're being misdiagnosed, you need to keep pushing. I wasn't
Yeah.
being misdiagnosed. I'm not saying that. I knew there was something going on though.
Yeah, they got it. I mean, the urologist knew even before she scoped you.
Well, she knew when yeah, because it was funny. She said, well, you're a smoker, right? How long do you smoke? She
Hmm.
gets in there, she goes, yep, that's what I thought. There it is right there. So we'll schedule you to see the chemo urologist to remove the tumor. She didn't s- mix words at all. I mean, I guess because I don't know if it was because that's just her style, or if it was because she knew I was in the medical field at coordinator.
Probably both.
Probably, but
Maybe a
yeah,
little bit of both. Well, Rod, I mean, thank God, you know, someone who's known you for over 10 years, you know, thank God, like personally, just thank God they found it quickly and early enough. And, you know, the 5 year prognosis is really good in the stage that they caught you in. And you're going to have, this is something you have to monitor the rest of your life, like you
yeah,
said, but
unfortunately. It
there are
sounds like
studies for that.
this Janssen study sounds like it's pretty promising now. They've already got the results of the first one that seemed to, show promise. Obviously, or they wouldn't be doing the second one.
Yeah. Yeah. So, and the thing about being in a cancer study is you get that follow up, like constant follow up. So if you know, like the PI would know if it's not serving you best interest to remain in the study, they'll put you somewhere else.
Right. And he already asked me when I was having all the inflamed, and all the symptoms and stuff I was having. He asked me, "Do you want to continue doing this?" And I was like, "Yeah, no, I'm not ready to stop."
Hmm.
So
Was there you were getting there even though you were in like that was the second like the adverse events, but there was a therapeutic benefit of you remaining in,
yes,
according to him and you both, right?
right.
Yeah. Yeah, that's the important part. And
No pain,
the
no
thing,
gain, apparently.
no
How
pain, no
true it
gain.
isn't.
This is true. And one of the benefits of research is that extensive, like thorough looking under every rock, labs and different assessments that you don't normally get in standard of care.
It's funny because I'm like, well, do I need to report this in the AE or is this an AE or is this just me being overly cautious or, you know? So it makes me wonder, do we hear? Because I always used to tell our patients, I want to know everything that happens to you. If you stub your toe, I want to know about it.
Yeah,
But I really wonder if we do hear all the AEs.
no way.
I don't
No
think
way.
we do. Or at least not, I can't imagine in cancer studies that people
We
are hearing
don't. I
all
was
of.
in a COVID study when I got COVID with Dr. Hazen. And,
Mhm.
same thing with her. Tell me every time you have any AE. I never did. I didn't have any AEs in the study, but of course I did. I mean, I would have headaches. I would have nausea when I first took the azithromycin. But no, I didn't report any. And you're right. I think we only are seeing like 25% of the AEs. We're seeing the big ones. We're seeing
Yes.
the big one.
Yeah.
The
I
little ones
definitely was
go,
calling in when I didn't feel well, and I felt like that person that calls every time you turn around. Oh, I have another AE or another event going
yeah,
on. But that was
yeah.
just, hopefully I won't
Mm.
feel that way again. But if I do, I guess I do. So
Hopefully not, man. I think, you know, well, you've got important work to do at Investigator Research Group over there in Indianapolis, and now you can tell the patients, hey, I'm in the same boat. I'm
yeah,
also a study participant. Um, yeah, it just thankfully you're getting the treatment and you're documenting this journey with us, and I think it's important for people to learn from.
the only thing I would say is be at vigilance about even your lab work and stuff too that you get when you're on the study. I
Mm.
had a neighbor that recently passed away that was getting immunotherapy. When they looked at his labs, it's like, yeah, they're slightly abnormal or whatever. He ended up in the hospital for the next month, and um, he ended up dying because he went into kidney failure. Why they did his immunotherapy that day, I don't know.
I
They
see.
didn't think his labs were that abnormal, but that was eye opening for me too. It was like, okay, I guess I'm gonna make sure I pay attention to what's going on with my blood work
Yeah,
because he was doing
definitely
really,
so.
really well on a lung cancer drug, and he
Oh,
was
lung cancer. Okay.
um, but then he ended up going into renal failure, and it was all, at least it appears that it was all from the therapy that he got that day when his labs weren't normal. He shouldn't have, his kidney function and stuff probably weren't as normal as they should have been.
It's another thing you learn, and maybe you can share with your patients. Like, well, our patients also ask, some of them ask for their lab results, and we make them available. Like, here's your labs. It's not just for the doctor to look at, it's for you to also be aware of your labs and
Right.
have a second
Sometimes
look. And for the,
excuse me. I'm sorry. Give me a second. Um, sorry about that.
oh, no
Monitor
worries. I
was.
said sometimes the coordinators also need to be vigilant and look at lab results too. I mean, anyone can catch something that looks out of the ordinary, and sometimes the PI can miss it also.
Yeah, I mean, and I think sometimes as patients or as individuals, we need to be more vigilant with our health. Take some of the
Mhm.
responsibility and not just rely on our health care.
You got to become informed patients. I remember back
Yes.
in Twitter days, e-patient Dave, he was this cancer survivor. I wonder. I'm thinking it was like non-Hodgkin's lymphoma, and he became like this celebrity patient back in the day. He still goes on speaking gigs and stuff now. but he was the one advocating, hey, patients, be more informed, be more engaged about your treatments. Now we have labs, you should have your records, you should keep your own diary of your like the trends and really like be on the cutting edge of like the research that's going on. So he was teaching patients how to be more informed and
Especially if it's oncology type studies. I mean,
Mhm.
a life or death thing, but
Yeah,
we're seeing the patients before any of that has happened to them, typically.
yeah,
I mean, we're seeing them with the other normal or not normal, but the indications that we all get as individuals through our life.
outpatient. Yeah, outpatient.
Not
Yeah, I mean
not a life or death type thing usually, even though long
so
term can be.
sometimes it happens, man. We had a gal screen fail for one of our studies, and more than likely it was undetected cancer, according to our PI.
Yeah,
And
we've had that happen too.
yeah, so you see it everywhere. But Rod, thank you, man. I'm glad you're doing as good as you can,
Well, I'm pretty good
considering
at the
the
moment.
circumstance.
Yeah,
That's good. That's good. And Guru Nation is with you, man, supporting you, and we appreciate you coming on and doing this however often you feel like doing it. I think it's
sure.
a good topic idea.
And good awareness for people. So yeah,
Yeah, man.
I appreciate it.
So until next time, Rod, we will stop recording. We'll go back to business as usual of sharing study leads and more mundane things.
Right. All right.
Thank you. Everybody go connect, like, subscribe, comment, share. Bye bye.
Bye.